Medyascope viewers, welcome to This Week in Turkey. This evening on the agenda is the pandemic. Turkey has seen a five-fold jump in daily virus cases since March, when the government initiated a gradual normalization process. Currently, Turkey ranks fourth globally in new COVID-19 cases. According to the data released by the Ministry of Health, on April 15th, the number of new cases announced was 61,400 and the death toll 297. In light with this new data, the total number of positive cases in the country has surmounted 4 million and the death toll has reached the 35,000s. On April 13th, President Erdoğan announced that a 2-week partial lockdown will be implemented in Turkey to prevent further rise in the coronavirus cases with the start of Ramadan.
On April 13, Turkish President Recep Tayyip Erdoğan announced that a 2-week partial lockdown will be implemented in Turkey to prevent a further rise in the coronavirus cases with the start of Ramadan. The new measures announced by President Erdoğan went into effect on the evening of April 14 and will continue for the following first 2 weeks of the Muslim holiday of Ramadan. Under the new restrictions, the weekday curfew will now be held between 7 p.m. and 5 a.m. instead of 9 p.m. to 5 a.m. Domestic travels among cities are also banned except for necessary and urgent situations. Cafes, restaurants, and the likes are closed, only allowed to provide delivery and takeaway services. The wedding halls, sports centers, game halls, and beauty centers will be closed until the end of Ramadan. Citizens over the age of 65 and those under the age of 18 will be restricted from using public transportation. In accordance, the Turkish Ministry of Education announced that schools will restart online education as of April 15, with the exception of preschools, 8th and 12th graders. With these restrictions, the government aims for a significant reduction in the number of cases and deaths related to COVID-19. Under the circumstance that a significant progress is not achieved in the first 2 weeks of Ramadan, President Erdoğan said that stricter measures could be imposed. On April 12, a day before Erdoğan announced the new pandemic measures, the Minister of Health, Fahrettin Koca, made a press release following the Science Committee meeting. Regarding the upsurge in the rising number of COVID-19 cases and deaths, the Minister of Health said that 84 million of us are responsible for the increasing number of COVID-19 cases. His comment was criticized nationwide, both by politicians and by the citizens. Many oppositional political party leaders made statements that criticized the government for taking insufficient measures until it was too late and for handling the process poorly. Meanwhile, Russia suspended most air travel with Turkey starting from April 15 until June 1st. Russia cited the rising number of COVID-19 cases in Turkey as a reason why, although simultaneous tensions between two countries over Ukraine raised some questions on whether this was a politically motivated decision. Russia's such move became a serious concern for Turkey, as this meant cutting off a key source of tourism in the country.
Healthcare workers yesterday gathered in front of the provincial health directorates across the country to voice their concerns over the increasing number of COVID-19 cases and deaths. In Istanbul, healthcare workers gathered in front of the Istanbul Provincial Health Directorate to make a press statement. Setting up barricades, the police informed the groups that the press statement was banned by the Istanbul Governor's Office. In accordance, the healthcare workers attempted to hold their press statement nearby Çemberlitaş tram station. However, the police prevented the statement and clashes ensued between the healthcare workers and the police. Eventually, the police allowed healthcare workers to read their press statement, where the healthcare workers said, "We won't give up our right to life, stop deaths."
Artık tükendik. Söylenecek sözümüz yok. Çığlığımızla buradayız.
This evening, our guest is Professor Önder Ergönül. Professor Ergönül is the director of Koç University Işbank Center for Infectious Diseases.
Hello, Professor Ergönül. Thank you so much for joining us.
Thank you very much. Nice to meet you.
Sorry. So the case numbers as of yesterday have reached 4 million and some, and the death toll has surpassed 30,000, and the country has seen a five-fold jump in daily virus cases since the government initiated this gradual normalization process at the beginning of March. Currently, Turkey ranks fourth globally in new COVID-19 cases. We'll speak about the measure announced this week as well as the vaccination process, but first I'd like to ask you how you evaluate the current situation of the pandemic in Turkey and whether or not these numbers are normal. How did we get here?
Thank you very much. In fact, now we can explain this situation as the third wave in the pandemic since the last year. We have more than 1 year right now in Turkey and among the other countries. So Turkey was in a good position at the first wave, for instance, but now in the third wave, in the last one, starting from the mid-March, the numbers started to increase per day. So if you look at the new numbers, new cases every day, these are increasing since the beginning of the April, almost the last 15 days. Every day we have more cases than the previous day. So we in fact measure this increase as the number of new cases per 100,000 population. Today, Turkey has 69 new cases per 100,000 population. So this is one of the highest in the world, I can say. And especially in Europe region, the closer country to Turkey is Sweden and then France. But Turkey is leading among these, also including similar countries. So, of course, the question is why we have so many cases, although we were not that bad in the previous months. Of course, what I think, so the restrictions were violated, actually. Restrictions were violated. So the psychology of the masses and psychology of the people can easily be changing. Of course, this was a very difficult situation in the world history, and people are getting tired and depressive. Psychological problems are also very important besides the economical problem. This is an overall humanity crisis, in fact, at the global level. Therefore, here on one hand, supporting the psychology of the people, healthcare workers, and also the population, whole population, and also putting some reasonable, justified measures are very important. In this concern, the maximum restrictions, optimum maximum restrictions were quite important. Since we are having the highest number of the cases, we were expecting more restrictions, in fact. Like just it's an acute crisis alert situation in Turkey. According to WHO, we are at the fourth level of the alertness. That means the maximum alertness. Therefore, what we need to do was already been designed or described by the WHO. Therefore, what we expect from Turkey to follow up with the scientific facts, these are observational, some of these non-pharmaceutical interventions are, by definition, could be observational most of the time. But this is also a science and gathered by WHO and similar international institutions. We should keep their advices and their experience and their observations. Therefore, we need to have, it seems that we need to have a bit more strict measures to prevent this unexpected outbreak in Turkey.
Mm-hmm. Thank you, Professor. As you mentioned, people are really exasperated, and it's really noticeable, especially on the streets here of Istanbul. We start noticing more and more people wearing their masks incorrectly. It's very difficult to have social distancing because of the crowds, and people have to go to work and so forth. So this sense of exasperation and yes, is really kind of felt in the public. And so this week, President Erdoğan announced the measures for Ramadan. And from what I understand, from what you're saying, since we're at the maximum alertness level, I'm assuming that these measures are not going to be sufficient then to curb the numbers. Is that correct?
I think so. I mean, so the government explained that this will be the first 2 weeks as semi-restricted measures, but then if necessary, they will jump up to the whole restrictions. So I think what I was expecting, like many other colleagues of mine, we were expecting that starting by the whole or the complete restrictions from the beginning, and then just losing afterwards if it is necessary, just the reverse way. In fact, maybe we will see that the government has to do upgrading the restriction measures, going to the complete restrictions, for instance. That means, which includes the abandoning of the, the working and the limiting the transportation more, etc., and the curfew, more strict curfew measures. In fact, my observation in the first week of that semi-curfew, whatever we call it, semi-restrictions, kind of curfew, and it didn't change much. I mean, still the streets are full and people are just couldn't realize and didn't touch to their life, it seems like. And also it is a bit early to see the number changes, of course. I mean, we will see the results maybe next week. Hopefully, I hope it will be lower, but it seems that such semi-restricted curfew may not work, and then we may go upscale the restrictions.
Mm-hmm. As a matter of fact, healthcare workers, the Turkish Medical Association has, since the beginning of the pandemic, demanded or underlined the importance of having a minimum of a 14-day lockdown in order to curb the spread of the virus. So do you think that we've come to that point? And will 14 days be enough? Because some say 14, some say 28. So is this absolutely necessary at this point?
It may be. I mean, of course, sometimes 14 days total lockdown were always demanded by the Turkish Medical Association or similar organizations. But in fact, we are at the most sensitive time right now. I mean, if you say something throughout the whole pandemic, let's say for 1 year, it shows that it's not that sensitive enough. But now we are so sensitive to apply the total lockdown for at least 2 weeks, and then you can see the result. You can catch whether you will continue for the next 2 weeks or not. But since the incubation period is 14 days, so 14 days of lockdown could be necessary for the first step.
Mm-hmm. One of the other measures that was taken this week has to do with the citizens over the age of 65. Now, they've been restricted once again, their circulation has been restricted. And this has been very controversial since the outset of the pandemic here in Turkey, where periodically those below the age of 18 and those above the age of 65 have been restricted to their homes. Now, this is also the population which has been vaccinated at this point. So why is the vaccinated population not allowed to go out? I mean, there's also a lot of questions in relation to the effectiveness of the Sinovac vaccine that has been administered here in Turkey. Do you think that these new restrictions in relation to the vaccinated population relates to this lack of effectiveness of the vaccine, perhaps?
Yeah, this could be. In fact, the effectiveness of the vaccination, according to the recent reports, is not that much for Sinovac. For instance, today we have a report coming from Brazil, Brazil, and the effectiveness of the vaccination is about 50% or 60%. So if you think that over the age of the 65 has only protected at 50% or 60%, then of course the curfew still is necessary for that age group. I don't know whether was this the justification by the Minister of Health, but this makes sense. But also, this is not enough. That's okay. This is not enough. This is not the critical part of it. The critical part is having a good psychological, economical support for the society, giving the confidence. This is the most important thing. This should be achieved in any way. I mean, this is the most critical thing for all over the world, for all countries to achieve the confidence and transparency for the people. It is not easy, but the governors of the pandemic, whoever, or who is the responsible person, they should be giving these numbers. Scientists in this country and or the physicians, they are doing the best. I mean, I don't think that they are the first responsible person, the responsible people. We are all doing our best, and even we don't count the hours a day that we are working. Not only the physicians, not only the scientists, but the nurses and all healthcare workers. They are working very hard, but they also expect some appreciation, of course, and this is quite normal. What they expect from the government, they should have some appreciation, good words at least, and respect, kind of things, and
listen to perhaps their concerns as well, because they've been recommending several things throughout the pandemic, which seems to have been kind of ignored.
Yeah, exactly. I mean, also it should be easy for the government to call medical association or trade unions to collaborate. I mean, here the primary responsibilities belong to the government everywhere. I'm talking in general. These are universal concepts. So it is easy to work with Turkish Medical Association or any other healthcare workers associations for collaboration for a single target, which is the health of the societies. And therefore, this is a big problem, big humanity crisis, in fact, this pandemic, and we should all be able to collaborate. If we can do it, it is much easier to overcome that problem.
I know, Professor Ergönül, you have a very limited time, but I have one more question to ask you before leaving you. Minister Koca said that Turkey would receive 30 million doses of the Pfizer-BioNTech vaccine by June. So if this actually happens, can we reach a better stage in the pandemic by speeding up the vaccination process? And if it doesn't, what do you expect in the upcoming months if, the measures recommended by medical experts are not taken and the vaccination process does not speed up?
Yeah, this is a very good news, actually. This is good news. And because many of the countries now, they are targeting to decrease the effect of the pandemic by the autumn. I mean, by the September, let's say. Of course, even this is a very ambitious decision. Now, if we can control the outbreak in the summer months, then this is really a good result. Everybody, every country at individual or country level, adapting themselves to minimize the effects of the pandemic by starting by the end of the summer. Therefore, having such an amount of vaccination at the beginning of summer and completing the vaccination in a few months, and we have seen that Turkey has a great capacity in making the vaccinations. We can say, we can accept this. This is one of the good part of Turkey. Then in few months, if we can vaccinate such amount of people, that will be great. I mean, then we can open the schools and everything by September. So all countries are looking forward for such a result, in fact, and then we will see. Because always we had to postpone our good wishes to the later future months.
Well, later.
This was the character of that pandemic, I can say.
Professor Önder Ergönül, thank you so much for having joined us today.
Thank you very much.
On April 13th, Turkey's main opposition, People's Republican Party, hung posters in the Turkish parliament and other party buildings that said, "Where is the $128 billion?" criticizing the missing $128 billion from the foreign exchange reserve. The police then removed these posters with orders from the prosecutor's office.
The main opposition, CHP, has been hanging posters that draw attention to the $128 billion decrease in the central bank reserves. In accordance, The posters started to be removed from the CHP buildings through an order from the prosecutor's office. CHP Istanbul Chair Canan Kaftancıoğlu said that she will file a complaint against those who remove the posters. On April 14, the posters were rehung on the CHP buildings in Istanbul, despite the order for their removal. CHP Chair Kemal Kılıçdaroğlu pointed out the previous documents released by the central bank in his party's group meeting at the Turkish parliament and said the following. The central bank used to publish the foreign currency that they have sold by creating charts. They would indicate whom it was sold to and at which rate they sold it. Now, this information does not exist. Why are you hiding this information? Who did you provide these big advantages to? Did Erdoğan do this, or was it his son-in-law Albayrak? President Erdoğan responded to Kılıçdaroğlu's comments with the following words. For those who are trying to create a financial fluctuation by using the pandemic as an excuse, we will not respond to them. The majority of the foreign currency that Kılıçdaroğlu is always asking about has been used to fight the COVID-19 pandemic. CHP has proposed a resolution to the Turkish Parliament's General Assembly for the disappearance of $128 billion from the central bank to be investigated, but the resolution was rejected. Medyascope editor-in-chief Ruşen Çakır evaluated CHP's "Where is $128 billion" posters by linking it to the justice walks that Kılıçdaroğlu held back in 2017 against the arrest of CHP Istanbul MP Enis Berberoğlu. The Justice Walk was one of the first significant indicators that the opposition has come to a new start. It was a reaction to the decision of Enis Berberoğlu's arrest. This walk changed many dynamics and proved the presence of the opposition. I think that the question of where is the $128 billion is another indicator that the dynamics are changing. This campaign seems like it is going to be very effective. This was apparent ever since the beginning when Kılıçdaroğlu mentioned it during his budget talks. This discussion created a major discomfort around the ruling Justice and Development Party. They have given various answers. Some have said, it is none of your business. Some have said, it hasn't gone anywhere. But none of these have been satisfactory explanations. And it is apparent that the opposition will not let go of this question anytime soon. The debate around $128 billion missing from the central bank reserve started in November 2020 when the Minister of Treasury and Finance, Berat Albayrak, suddenly resigned from his position. Following Albayrak's resignation, the opposition party leaders and economists started to question the reasons behind the decrease in foreign currency.
14 retired admirals had been taken into custody last week for having penned an open letter urging the government to preserve the Montreux Convention. The government was quick to slam the statement for suggesting a coup. Prosecutors in the capital Ankara subsequently launched an investigation into the retired admirals for conspiring against state security, and detentions were carried out. On April 13th, all 14 former army officials were released from detention on condition of judicial control.
Since written notifications have been sent to 6 retired admirals and 1 retired general in Istanbul, Muğla, Antalya, and Ankara as part of the investigation, the houses of the retired admirals and the retired general have been searched and their digital materials have been seized.
This week has been a busy one in diplomacy. Turkey and Libya renewed their commitment to their maritime deal. Minister of Foreign Affairs of Greece paid a visit to Turkey, where bilateral relations and regional issues were discussed. And lastly, Turkey's foreign minister announced that a delegation from Turkey will visit Egypt in May for normalization talks. Here are the details.
The head of Libya's new interim government, Prime Minister Abdülhamid, and Turkey's President Erdoğan have affirmed their commitment to the 2019 Maritime Agreement, delineating the maritime boundaries between the two countries in the Mediterranean. Speaking following a meeting on Monday in Ankara, Erdoğan pledged to support Libya's unity, its reconstruction, and its military. Erdoğan also stated that Turkey will be sending 150,000 COVID-19 vaccine doses, as well as managing a pandemic hospital in Tripoli to help the country battle its outbreak. The two countries also agreed to take steps to facilitate the return of Turkish companies to complete stalled projects in Libya. Turkey has been closely involved in Libya, backing the United Nations-recognized Government of National Accord based in the capital Tripoli that control the west, against renegade military commander Khalifa Haftar's Libyan National Army based in Benghazi, that controlled the east. In other foreign relation news, Greece's foreign minister Nikos Dendias was in the capital Ankara on April 15th to discuss the bilateral relations and problems stemming from the Aegean Sea and the Mediterranean as part of mutual efforts to normalize the strained ties. The visit is the first between the two nations after tensions rose high in 2020 over maritime boundaries and energy exploration rights in the eastern Mediterranean, leading to a military buildup that featured warships from the two countries facing off. The press conference at the end of the meeting between the two foreign ministers, while starting off with warm messages, escalated rapidly into a war of words. Dendias expressed support for Turkey's bid to join the European Union, but also underlining that any violations of Greece's sovereignty would be sanctioned, prompting an angry response by Çavuşoğlu, describing Dendias's words as unacceptable. On April 15th, Çavuşoğlu announced that a Turkish delegation will visit Egypt in May as part of Ankara's efforts to mend ties. Turkey and Egypt froze ties after the 2013 overthrow of ex-president Mohamed Morsi. Turkish officials last month said Ankara had established the first diplomatic contacts with Cairo since 2013 as part of wider efforts to repair relations with other Middle Eastern rivals.
Prominent novelist Ahmet Altan was released from jail late on April 14th after Turkey's Court of Cassation overturned the conviction against him. The 71-year-old novelist has been behind bars since September 2016 on charges relating to the failed coup attempt of July 2016.
The Court of Cassation on April 14 overturned the conviction of prominent novelist Ahmet Altan, ordering his release from prison after nearly 4.5 years behind bars. Soon after the court's ruling, lawyer Figen Albuga Çalıkuşu announced that Altan has been released from jail and shared a photo of him on Twitter.
I have just welcomed Ahmet Altan. First steps to freedom.
Çalıkuşu wrote. The ruling came a day after the European Court of Human Rights said that Turkey violated Altan's rights and ordered the country to pay Altan 16,000 euros in non-pecuniary damages. Along with journalist Nazlı Ilıcak, Altan was accused of knowingly supporting the 2016 failed coup attempt by spreading subliminal messages announcing a military coup on television. Altan was then sentenced to 10 years and 8 months in jail, while Ilıcak received 8 years and 9 months on the charge of willingly and knowingly aiding the terrorist organization. In November 2019, Altan and Ilıcak were released under supervision, but Altan was then re-arrested just a week later.
Tuesday, April 13th marked the 100th day of the Boğaziçi University protests against President Erdoğan's appointment of Melih Bulu as rector. A series of events were organized to mark the day by the students and the academic staff. Here are images from the 100th day protests.
Basının ve mezunlarımızın alınmadığı, çevresinde polisin ağır silahlarla devriye gezdiği kampüsümüzden sesleniyoruz. 100 gün önce üniversitemize demokratik olmayan yöntemlerle bir rektör atandı.
Okulumuzu başta kadınlar ve LGBTİ artılar için olmak üzere okulun tüm bileşenleri için güvensiz bir hale getirmek isteyen, rektörü olmaya çalıştığı öğrencileri demokratik bir rektörlük seçimi istedikleri için gözaltılarla, haksız soruşturmalarla yıldırmaya çalışan Kayyum Melih Bulu ve kayyum kadro gidene kadar direnişimiz sürecek. Biz kalmayacağız!
That's all from This Week in Turkey. See you next Friday at 9 p.m. Good night.